Hi everyone, welcome back to our Oromedica Clinic lecture. This is my YouTube channel, Nourished Living. Today we will discuss about how to improve your digestion. My name again is Casper, Doc Casper. I'm a physician, registered holistic nutritionist, functional medicine practitioner. We're gonna go over with these topics: human digestive process, common digestive symptoms and causes, lifestyle changes to improve digestion, different diets or food lists that can affect digestion, digestive aids, and we will touch briefly about functional tests. So I made this lecture because a lot of patients are inquiring in our page, complaining of burning, sometimes belching, regurgitation, acid reflux. So I hope this lecture may provide some information and hopefully will help you. As a disclaimer, this presentation is for educational purposes only and is not intended to diagnose, treat, or replace the management of your healthcare provider. Pag may concerns kayo regarding health, please contact your physician. My lecture is mostly about dietary modification. So I would suggest if you have this following condition, you consult your physician, like diabetes, renal disease, endocrine disorders, hypertension, peptic ulcer disease, inflammatory bowel disease such as Crohn's and ulcerative colitis, eating disorder like anorexia, bulimia, and if you had a surgery recently. I believe in this saying, you are what you eat. This is a word from Anselm Brilliant Savarin, 1826. Kasi kung ano yung kinain mo, it reflects your health. If you're eating bad, your health is bad. If you're eating good, your health is good. And also, I will add, you are what you eat and what you absorb. Kasi kung gaano man ka-healthy ang food, but if you're not absorbing it well, wala ring mangyayari. Okay, para maintindihan natin yung mga problems sa digestion, we need to understand ano yung normal process. Ang digestion po starts when we see the food, no? Actually, pag meron tayong favorite na food, uh, we uh, we already start our digestive process, no? Yung salivary gland natin nagpo-produce na ng mga saliva. So it's already occurring. But once inside our mouth, so what we do is we chew them, right? Parang milling, merong mixing, and then until such time na magiging bolus po siya, no? Parang bola. And then it will go down to our digestive tract. Dumadaan po muna siya sa esophagus, no? And then through peristalsis, bumababa yung food. And then pumupunta siya sa stomach. Dito sa stomach, this is the place where it is very acidic, no? And kailangan ng stomach ng certain pH na acidic because para ma-activate yung pepsin, which is the enzyme to break down protein, no? Lalo na pag kumakain kayo ng karne, the stomach needs a certain pH para ma-break down yung kinakain. And then also further milling, further mixing, and then magiging chyme po siya, no? Then pumapasok siya sa small intestine. So yung mga maliliit na bituka. And then doon sa small intestine, doon po na further breakdown yung food until magiging smaller particles na siya, no? Yung protein naging amino acid, yung fat nagiging fatty acid, yung carbohydrate nagiging glucose. So in that molecule, pumapasok po siya sa digestive tract natin. And then pag pag naging na-absorb na yung mga nutrients, pumupunta na naman siya sa large intestine. So yun yung mga substances, mga fibers na hindi nadadigest ng human being. So kaya yun yung nagiging dumi and then magiging waste product. Ang trabaho lang ng large intestine is absorption of water and some vitamins, no? And then the rest na maiwan, it's a waste. So any problem from the mouth hanggang sa baba, um, pag may disturbance sa pH, disturbance sa peristalsis, mayroong obstruction, mayroong malabsorption, so nagkakaroon tayo ng problem. Digestive problem or symptoms, no? Ito yung mga common na usually kino-complain ng pasyente. But there is about 11.2% who suffered from functional bowel syndrome. Ibig sabihin, wala pong nakikita sa endoscopy or colonoscopy. However, the patient is complaining of symptoms, no, such as dyspepsia, parang kabag, gas and bloating, parang may hangin, regurgitation, yung kinakain mo bumabalik sa taas, no, sa throat mo, belching, sige dighay ng dighay, heartburn, parang nasusunog yung chest mo, akala mo nag-heart attack ka na. Ano lang pala yun, acid reflux. Abdominal distension, abdominal cramps. So lumalaki yung tiyan, minsan sumasakit yung tiyan, parang natatae. Flatulence, yung parang laging utot ng utot, is already a sign of digestive problem. And diarrhea and constipation. There are also symptoms na very serious like bloody diarrhea, yung ibig sabihin nagdudumi na siya ng dugo. So pag may mga ganun na, you really have to consult with your physician. So ano yung mga causes, no? Marami pong causes. Kung sa stomach naman, meron pong condition na tinatawag na underactive or overactive stomach. Underactive meaning masyadong, di ba kanina sabi ko kailangan ang stomach natin should be in the right pH, no? Pag masyadong alkaline, nakakaroon ka ng indigestion. Pag sobra naman ng acid, nagkakaroon ka ng gastritis or ulcer. May iba naman due to hormonal or chemical imbalance. Our digestive tract is actually metabolically active. So nagproproduce siya ng mga certain substance or hormone that can affect our appetite, our satiety, meaning signal, no, na we are already full when after eating certain food. And sometimes this hormone can also influence the movement of the food, even the gallbladder contraction. So merong mga hormone, no, that can influence all of these. Another causes is enzyme deficiency or intolerance. So merong mga cases na due to damage, no, sa lining or sa, for example, yung lactose intolerant. So yung lactase kasi is an enzyme that is produced in the brush border of your small intestine. Kaya lang, due to siguro nagkaroon ka ng bacterial or viral infection before, tapos nasira yung lining, kaya hindi ka na nagpo-produce ng lactase. Kaya nagkaroon ka ng lactose intolerance. Meron ding condition na dysfunction of esophageal sphincter or esophageal stomach or bowel motility. So yung sphincter po, para po siyang valve, no? So if you understand, yung for example, yung faucet sa bahay nyo, yung gripo, meron po siyang valve para hindi po tutulo yung water, no? Parang ganun lang yan. And then, ang problema lang sa acid reflux is, hindi po tight yung sphincter. And then, lumuluwang siya. Wala siyang, hindi masyadong mahigpit, no? So, yung kinakain mo, bumabalik pataas. So, maraming causes din yan, no? Na bakit nagkaganon? Just due to becoming obese, dahil sa mga kinakain mo, pag masyadong madami yung kinakain or due to alcohol or carbonated drinks. So maraming causes. Another causes no ng digestive problem is infection. So alam naman natin no pag meron talagang bacteria or virus or fungal or parasite can cause digestive problem. And then dysbiosis. Yan po yung term lalo na pag nag-imbalance yung population ng good at saka bad bacteria. Meron ding mga psychological or behavioral factors. Diba, pag napansin nyo, pag wala kayong you are emotionally you are in emotional distress, you are sad, you are angry, hindi po kayo natutunawan kaya nagkakaroon po ng indigestion. And then the same thing, food intolerance, na discuss ko na yan. So ito yung hitsura ng gastroesophageal reflux disease o yung acid reflux. So actually, ang problem ng case na ito, normal naman ang acid, no? Kaso lang, napunta siya sa esophagus. Ang esophagus kasi, yan yung daanan ng pagkain na supposed to be, it's not acidic. Yung acid po kasi bumabalik sa taas, no? Kasi nag-o-open yung valve or yung sphincter. Kaya ang problem, nasisira po yung lining ng esophagus. Kaya yung minsan, para kayong hindi makahinga, no? Kasi parang ang tendency nasugat po yung esophagus. Nag-i-spasm po siya, no? Kaya pag nag-iswallow kayo, feeling niyo parang dry, feeling niyo yung food parang hindi bumababa, and parang feeling niyo hindi kayo makahinga. So that is already gastroesophageal reflux disease, no? So yeah, we have to do something about it. So another causes is mga even prescription medication. So remember, if you have all of these, you have to ask your doctor, no? Let's say biphosphonate. So ayan yung tinatawag nating Actonel. Yan yung binibigay pag meron kayong osteoporosis. But sometimes nagkakaroon tayo ng problem sa esophagus. Non-steroidal anti-inflammatory drugs. So example niyan, mga Advil, ibuprofen, Alaxan, ayan, nagkakaroon po ng gastritis or esophagitis. Ferrous sulfate, no, iron pills pang sa mga anemia. Potassium chloride, minsan binibigay yan pag mababa ang potassium dahil sa kidney problem. Quinidine at tetracycline, yan po yung mga gamot sa heart, and tetracycline is antibiotic. So, kaya pag prescribe kayo ng ganitong medication, so you should know na meron po siyang side effect, no? Magkaroon kayo ng acid reflux or esophagitis. Yung digestion natin, nag-change din siya kagaya ng balat natin, no? Nung baby tayo, medyo makinis, walang kulubot. Pag tumanda na, may marami ng wrinkles, kulubot. Ganon din ang digestion. Merong mga changes, no? Age-related changes. But according to the study, no, the most common one na nagkaroon ng problem is the capacity to digest fat. Kaya pansinin nyo, pag oily masyado yung food, minsan parang hindi kayo natutunawan, no, or kabag. It's because of age-related changes. Meron ding mga condition na can reduce the gastric emptying, no? Lalo na yung pag meron kayong chronic diabetes, depression. It can also slow down your whole gut transit time. Hypothyroidism, yan po yung mabagal po or tamad po ang yung thyroid. And then chronic kidney failure, no? It's linked to impaired gastric emptying. So, merong mga nangyayari, no, age-related, or kasi usually pag matanda na, marami nang nararamdaman, may issue na sa blood sugar, sa thyroid, kaya nagkakaroon ng digestive problem. So ito yung summary ng mga changes, no, as we age. Our mouth become dry, our esophagus, hindi na masyadong tight yung valve, yung stomach, hindi na masyadong gumagalaw, kaya nakakain ka lang ng konti lang yung kinain mo, parang masakit lang yung tiyan mo, punong-puno na. Small intestine, hindi na masyadong mabilis. Yung colon naman, wala daw masyadong changes. At even the anus and the rectum, meron po siyang mga decrease in sensation, decrease in compliance, decrease sphincter pressure. Kaya yung iba, nagkakaroon ng incontinence dahil because of the sphincter disturbances. So what can we do, no, to prevent this from happening? So number one and mainstay treatment is lifestyle changes. So yan po yung gagawin natin, no, na we can do something about it, no, not necessarily medication kaagad. Just to mention, just yesterday I was reading an article from American Gastroenterology. Yun daw mga patient na nagtitake ng proton pump inhibitor, for example, yung omeprazole, pantoprazole, esomeprazole, lansoprazole, they have a risk of getting COVID-19 twice. Pag yung medication daw twice mo tinake, mas 3 times daw yung risk mo of getting the COVID-19. Although hindi naman yung cause and effect, but there is an association. So I would suggest kung meron kayong nararamdaman, hindi po kayo mag-self-medicate. Meron pong certain individual kung kailan po natin gagamitin yung mga proton pump inhibitor. Kaya mag-ingat po tayo kasi meron pong mga study ngayon na lumalabas about sa COVID-19. Okay, ano yung gagawin natin? Lifestyle changes. So start your morning with this one. Upon waking up, you drink a glass or two of filtered water. This is just to wash down all the impurities from the mouth down to our digestive tract. And then, most of us kasi is suffering from underactive stomach. Ibig sabihin, mababa po yung medyo alkaline yung pH, no? And nagkakaroon ng tinatawag na underactive stomach or achlorhydria. So, ang tendency, nawawala yung certain pH level ng ating stomach. Remember, I just told you na kailangan ng acidic pH para po ma-digest yung kinakain natin. So, what you do is you dilute an apple cider vinegar to a glass of water. So, 1 tablespoon to a glass of water. Or 1 glass of water, hatiin nyo yung lemon na fruit, and then you squeeze them, then take it 30 minutes to 1 hour prior to breakfast. So this is to prime your stomach, no? Parang i-stimulate yung stomach to produce acid. Not advisable for someone who has peptic ulcer disease. Kasi nasugatan na nga yung stomach nila and then uminom ka pa ng lemon, so nagkakaroon ka ng further damage. At saka napapansin ko yung mga pasyente, nagle-lemon water sila, no, lagi. Kaya lang, pag nasobrahan, hindi masyadong mali yung pagka-prepare, masyadong maasim, nasusunog po yung esophagus nila. Kaya minsan, feeling nila, parang hindi na sila makaswallow, parang may nakabara sa throat, minsan hindi makahinga, dahil po nasunog po yung esophagus nyo. So, kaya wag nyo namang sobrahan kasi it can also damage. So, is GERD caused by too much stomach acid? So, ito yung sinasabi ko na yung mga patient na mayroong esophagitis, we expect, no, na yung pH nila is acidic, no? But actually, yung may mga severe condition daw, yung pH daw is nagiging alkaline, no? Probably because this patient are taking something, no, yung mga antacid or mga omeprazole, and then yung pH na di-disturb, no? So remember na kailangan natin ng normal acid, no? So yung I think na yung management ng bigyan kaagad ng antacid or proton pump inhibitor is the wrong way of treating it. Because ang nangyayari, hindi naman sa acid ang problema eh. Ang nangyayari po is yung sphincter o yung valve. So yun po yung main problem, hindi po yung pH. So another lifestyle changes, no? Chew your food well. Kailangan we have to chew our food properly. Kailangan, sabi nga ni Prince and Lucas, kailangan at least 20 to 25 chewing para daw mag-increase yung surface area ng food and then mas madali siyang ma-breakdown ng digestive enzyme. So we really have to chew our food properly and slowly. Hindi po tayo magmamadali. This is to show you na every food merong digestion time. Kaya pag kumain kayo, be aware of this. Kasi pag hinalo-halo nyo yung kinakain nyo, nagkakakos kayo ng digestive problem. So, water absorb immediately. So, pag nag-drink kayo ng water, kaagad yan ma-absorb. It doesn't need any digestion. Pag nag-drink kayo ng fruits and juice, it takes 15 to 20 minutes. No? Mag-i-stay muna siya sa stomach. Pag cooked vegetable naman, it can take up to 40 minutes. So, just imagine pag hinalo-halo mo lahat yung pagkain, so nagkakaroon kayo ng indigestion. And then sometimes yung acid bumabalik po sa taas. Isa po yan sa mga cause ng mga acid reflux. Fish naman 45 to 60 minutes. Yung chicken 1.5 to 2 hours. Yung beef naman 3 hours. Ang pinakamatagal po is pork 5 hours. Kaya yung iba sa atin halo-halo ng kinakain lalo na sa fiesta, buffet, halo-halo lahat ng kinakain. So just imagine, the hours are keep adding and adding. No? Kaya parang feeling nyo busog na, hindi na bumababa yung food. Isa po yan sa cause na na-damage po yung sphincter natin sa esophagus dahil sa sobrang kain ng kain. Don't drink fluids during meal. No? You may disagree with this, but this is why it should not be done. Kasi yung stomach natin is supposed to be acidic. No? May pH po siya na 1.5 to 3.5. So just imagine if you're eating and then you're drinking a lot of fluid, no, which is alkaline, 6.5 to 8.5, nadi-disturb po yung pH. Remember na it needs acidic pH para po ma-activate yung enzyme na pepsin. So, hindi po mabi-breakdown yung food kung alkaline po ang stomach. You have to wait at least 30 minutes to 1 hour after meal before drinking fluids. Eat mindfully and slowly. So, lagi kong sinasabi na dapat hindi tayo distracted when we eat. We're not supposed to look at our phone or to look at TV or mga movies because we're supposed to enjoy the color, the smell, the texture, and taste. And we should be eating when we are relaxed, no? Hindi yung parang galit ka, upset, or sad. Because hindi po talagang matutunaw ang food. And para naman sa gusto magpapayat, it takes about 20 minutes of eating before maka-feel tayo ng full. Kaya kahit madami pa yung nilagay mo sa plate, but if you're eating slowly, no, if you are chewing your food properly, pagdating ng 20 minutes, feeling ng tiyan mo, busog ka na. So this is a drawing, no, na to show you na yung mga ancestors natin, ito yung kanilang form of stress. Pag may na-encounter sila na something threatening like for example a lion or a tiger, no? So dalawa lang yung mechanism ng body, is either you fight or you flight, no? Takbo ka or pwede mo siyang i-fight. Ganun lang yung mechanism ng body. But right now, our modern stress is no longer mga lion or tiger, but it could be our job, our relationship, financial, our school, no? Madaming cause na ng modern stress ang tawag diyan. Our body cannot distinguish between ano yung threatening, no, at saka sa hindi. Basta pag ang body mo perceives certain unpleasant things, yung body mo will react the same thing. So ito yung tinatawag na fight or flight response. So ang mangyayari, digestion standpoint, nagda-dry yung mouth, nag-i-slow yung digestion. Aside from, you are having fast breathing, heart pounding, sweating, or dilation of pupil. So, kaya we really have to eat, no, na hindi tayo upset, sad, or anger kasi it really affect our digestion. So other lifestyle changes that we can do. So kailangan pag mataba kayo, overweight, most likely nakakaroon kayo ng GERD. Kaya the best treatment po ng GERD is not actually mga omeprazole, pantoprazole, hindi po. The best is weight loss. Pag overweight kayo, you really have to manage, no, your weight, and then elevation of head of bed at night. So pagkakain ninyo, hindi kaagad kayo higa, no? Kasi ang nangyayari, puno pa yung stomach mo, merong different digestion time yung food, tapos yung acid mo naka-stay lang sa stomach, tapos bigla kang hihiga. Anong nangyayari? Magba-backflow yung acid. So pag nag-backflow yung acid, nasusunog yung esophagus ninyo. So kaya when you after eating, dapat hindi kayo higa kaagad. You stay upright for at least 3 hours, no? And then avoid late meals. Kasi pag kumain kayo, no, late na sa gabi, hindi kayo natutunawan. Kasi ang sleeping kasi is supposed to be sleeping, no? Wala nang ibang gagawin yung katawan natin. Pero pag nag late meals kayo tapos biglang natulog ay hindi kayo matutunawan. Eating small frequent meals rather than large meals. Kasi yung stomach natin can only accommodate as much. Hindi po niya kaya yung large meal. Kaya yung iba, nagbo-buffet, masyadong maraming kinain, eh, napupuno na yung stomach, no? Hindi maganda. And then, merong mga food and drinks na if you have GERD or acid reflux, these are the things that you should avoid. Chocolate, coffee, alcohol, mga fatty or oily foods, carbonated beverages like soda, acidic or spicy food, tomato-based products. So yan po yung dapat ninyong gawin, no? Hindi yung kaagad omeprazole, kaagad pantoprazole. Kasi meron kayong ginagawa or tinitake that can cause the problem, no? So just by changing your lifestyle, it goes a long way. Avoid din over-exercise kasi ang alam natin na exercise is very good, but sometimes vigorous exercise can affect or can worsen the gastroesophageal reflux, no? Even mga non-trained subjects, so they have this problem, no, sa motility and gastroesophageal reflux. I would suggest keeping a food diary. Kasi may iba na pag kumain sila, later on, para silang may kabag kaagad, no, or indigestion. So you have to be aware, ano ba yung nakain mo? It could be one of these, no? Hindi mo alam kung is it the dairy, the vegetable, the fruits. Kaya it's better if you keep track of what you're eating. So we will explore different diets. Kasi merong diet na can aggravate or can help your digestive problem. So, kaya sabi ko kanina, pag meron kayong medical condition like diabetes, for example, meron kasi mga diet that's not ideal for such condition. So, number one is proper food combining. So, ano ba itong proper food combining? So, ito yung principle na meron daw certain food na hindi talaga pwedeng maghalo-halo, no? So, proper food combining allow for optimal digestion and utilization of food and their nutrients. Ang sabi nila, eat fruits separately as fruit meals. Hindi yung kumain ka ng main course of meal and then after you followed it with fruit. Kasi ang fruit kasi, hindi sila magmi-mix sa ibang kinds of food. Kaya dapat kainin mo sila separately. Eat one protein food per meal. So, hindi yung halo-halo, no? Hindi yung fish, chicken, beef, pork, tapos hinalo mo sa tiyan mo. Remember, I showed you kanina na there is different digestion time to certain food. So, you really have to respect your stomach kasi ano yan eh, talagang ganun. Iba-iba yung digestion time. And this kind of approach is not ideal for diabetics. Kasi nga, yung fruit kainin mo as a separate meal, it might spike your sugar. Lalo na pag hindi hindi mo kinain yung mga fiber ng fruits, it can actually disturb your blood sugar balance. So ito yung chart no of what is food combining. So yung protein daw is poor mix with starches. So marami sa ating kumakain talaga rice with meat, grains with meat, potato with steak, potato with chicken, no? Hindi daw talaga mag-mix yung dalawa na yan. I'm not saying na ito yung ipa-follow nyo na diet forever kasi it may not be working with you. I'm just saying na pag may mga digestion problem kayo, you might try this kind of uh, approach, no? Food combining. Ang vegetable is good mix with starch or protein. So pwede mo silang i-mix. Yung fruit lang ang hindi pwedeng i-mix, no? Hindi mo i-mix sa vegetable, hindi pwedeng i-mix sa starches, hindi pwedeng i-mix sa meat, no, or sa protein. Kaya it should be eaten on a separate meal. Another diet no na they propose when you have digestive issues is avoiding high FODMAP diet. Ano ba yung FODMAP diet? These are fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So, ito yung mga sugar or alcohol content ng fruits and vegetable. So, for example, no, yung mga garlic, onion, napapansin nyo pag kumain kayo ng garlic, medyo nabo-bloated kayo. It's because it is high in FODMAP, no? Mga cauliflower, cabbage, mushroom, peas, and scallions. So as opposed to other kinds of fruit na nasa left side, no? Like mga green pepper, eggplant, cucumber, carrots, celery, potato, pumpkin. Sa fruit naman, apples, apricot, avocado, banana na sobrang hinog, blackberries, grapefruit, mango, lalo na sa atin tropical, peaches, pears, plums, raisins, sultanas, and watermelon. They are very high in FODMAP. Kaya kung may issue kayo na regarding sa fruit, maybe choose the low FODMAP diet, no? Yung low FODMAP fruit. Like pineapple, for example, strawberry, grapes, banana na hindi masyadong hinog. So that could be a right choice for you. Yung sa mga meat naman, obviously yung mga processed is high in FODMAP, chorizo, sausages, processed meat, as opposed to yung mga regular na meat natin. Sa bread, cereals, and greens and pasta naman, meron din no, yung mga granola, bran, barley, muffin, rye, spelt, mga wheat foods, no, na ibig sabihin yung mga pagkain na gawa sa harina. Nuts and seed, dalawa lang, no, yung very high in FODMAP, cashews and pistachio. So the other nuts and seeds are okay. This is the evidence that showing na if you follow a low FODMAP diet, it reduces the symptoms of irritable bowel syndrome. So ito yung mga condition na walang nakikita sa endoscopy or colonoscopy, but they have a problem with gas and bloating, constipation, or diarrhea. But if they follow this kind of diet, it may reduce their symptom. Gluten-free diet. I'm not sure how popular it is in the Philippines kasi wala naman kasi masyadong cases sa atin na celiac disease, no? But there is a study na if we eat gluten daw, even if you're not gluten sensitive or celiac, it can affect our digestion. So ano ba yung mga gluten? So anything na gawa sa harina, barley, rye, wheat, no? Mga all-purpose flour, enriched flour, cake flour, lahat. If you follow this kind of diet, sometimes it can be challenging because gluten can be hiding in a lot of food, no? Pwedeng sa soup, hindi mo alam na may gluten na pala, cereal, pasta, salad dressing, sauces, crackers, gravy, even mga food coloring, malt and beer, there could be some gluten. Kaya kailangan you have to find gluten-free Ito yung sinasabi ko na this is a double-blind randomized placebo-controlled trial na when they remove the gluten in their diet, even those people without celiac disease, there is there is an improvement. But right now, as of 2011, no, they have not elucidated yet the mechanism. Bakit ganon? But it could be na merong mga imbalances sa ating bacteria or something else, no, that causing this problem. This is a very big one. 75 to 95% of Asian are lactose intolerant, no? Kaya pansin ninyo, lalo na sa morning, mahilig magkape, tas lalagyan ng gatas, later on, napapansin para kang natatay, nagka-cramps ka agad yung tiyan. It's not because of coffee, it's because of the milk, no? The dairy products. So it can be sa cheese, butter, yogurt, ice cream, milk, whey, milk protein powder. So you have to evaluate kung iyan ba yung nakakos sa iyo. So you have to avoid it. So let's move on and talk about digestive aid. Kasi maraming may aside sa diet, no, aside sa dietary modification, there are also things that we can do para mas ma-enhance or mas ma-improve ang ating digestion. Number one is we have to maintain a healthy balance of microbiome. So ano ba yung micro? Micro means small, biome is the organism, no, that lives inside. So yan yung mga bacteria sa ating tiyan, no, nakatira. Kaya yung ma-advertise na okay ka ba tiyan, yan na yun. So did you know na we are more bacterial genes than human genes? Ang human genes natin is only 23,000. But the bacteria that lives in us is about 3.3 million genes. So imagine mo yan. So as you can see in the drawing, no, they live in your nose, your mouth, your skin, your lungs, your small intestine, even your urinary tract. So they are living in there. So ito yung summary of how the microbiome are affecting our metabolism, no? Sa mga fatty acids, sa ating gut-brain function, even in asthma, they are connected daw. Even inflammatory bowel disease, obesity, peripheral vascular disease. So maraming connection, no? Kaya it would make sense na we really have to take care of them kasi more and more evidence are showing na there is really a connection with the bacteria with our health. Kung nagtatanong kayo what is the best thing to improve our immune system is to take care of your gut. Why? Because 70 to 80% of your immune system is in your gut. So, pag marami kayong digestive issue, no, dahil sa mga medication, antibiotic, nasisira po yung immune system ninyo, no? So we have to support them with proper diet, probiotic, prebiotic, and avoiding antibiotics, no? And balance the pH. So ito yung busy slide na how the food, how the bacteria, our intestinal lining, and our immune system are communicating with each other, no? So let's say yung mga antibiotic, no, they disrupt the beneficial bacteria. Yung probiotic naman can help replenish those good bacteria. And then there are also bacteria na they are causing constipation, no? Tinatawag silang mga methanogens. And then our immune system, yung sa baba, no, makikita mo may mga mast cells, macrophage, T cells, B cells, so they are interacting talaga. Kaya sinasabi ko, 70 to 80% of our immune system actually in our gut. So pag may butas po yung gut natin because na damage, no, yung mga kinakain natin, mga medication, pumapasok sila as a big molecule and then our immune system will overreact. So kaya nga meron daw theory or hypothesis why the autoimmunity develop, no? Probably because of this mechanism. This is a twin study, no? So pinag-aralan nila sa kambal yung bata kung ano yung mga imbalances in bacteria with patient with ileal Crohn's disease. Kasi daw, ang Crohn's disease kasi ganito yung hitsura, no? Yung medyo mapula, parang patchy-patchy lang siya, no? Hindi lahat ng ah, length ng intestine, yung large at saka small, are being affected. Bakit daw yung iba merong predisposition sa ileum, while yung iba naman sa other parts? So sabi nila, it's because daw of certain bacteria that lives in that part of intestine. So kaya meron talagang connection why such diseases are manifesting that way. So there is a connection with bacteria. Ito naman, very interesting. Yung mga payat daw versus mataba, magkaiba daw yung bacterial composition. So, pag ang isang individual daw nag low fat diet, ang mangyayari is dumadami yung bacteroides, uh, nagdi-decrease naman yung firmicutes. Pag masyadong marami yung fat natin, madami daw yung firmicutes kaysa sa bacteroides. So could it be na if we correct the number of this bacteria can decrease our weight, no, our fat, no? We don't know yet, but there is an association with the bacteria. So human gut microbes is associated with obesity. And then meron ding iba uh, na let's say diabetes or pre-diabetes, iba-iba daw yung composition, diversity, and abundance of bacteria. Ito namang study na to na they demonstrate na yung obese daw has a different gut flora composition than sa mga payat, no? And then there are some bacteria na they are very efficient in calorie extraction, no? Kaya daw yung iba na mataba, madaling magtaba, it's because meron daw bacteria na nakatira sa kanila that's very efficient with extracting the calories. Okay, so having said about microbiome, so we cannot forget about H. pylori kasi ito yung common bug, no, lalo na sa developing countries, that causes gastritis, ulcer, no, bacteria that lives or infect your stomach. Nakukuha natin ito sa water, soil, or poor sanitation. And then nakokontaminate yung food, kaya pwede natin silang ma-ingest. Nearly 50% of world's population is infected. So very common. Can cause chronic gastritis, ulcer, and stomach cancer. Meron lang silang controversies because some individuals have the bacteria but no symptom. Bakit kaya yung iba may bacteria pero wala naman silang symptoms? And then pag pinatay daw natin yung bacteria in a patient who has GERD, it shows na may lead to development of new erosive GERD. And then eradication may not affect the healing rates nor the relapse of patient who already have the GERD. So parang wala daw effect, no, sa healing pag ineradicate mo sila as compared sa iba, no, yung mga normal. Okay, so what are ways to improve your good flora? No, kaya kanina na-discuss natin how important, how they are associated with certain condition, diseases, obesity, inflammatory bowel disease. So we have to know how to improve them. Eat well-balanced, colorful diet. Eat your rainbow foods. Eat at least 30 grams of fiber a day, both soluble and insoluble fibers. So, lalo na may psyllium seeds or husk. Eat fermented food or drinks such as sauerkraut. Yan yung fermented cabbage. Kimchi. Yan yung Korean food, no, na spicy. Kombucha naman is it's a fermented drink, no, made from dairy or products. Consider good quality probiotics, no, kasi pag kagaya ko, I tested myself, nagkaroon pa ako ng lack of lactobacillus. So I need to supplement myself with lactobacilli na probiotic. Avoid unnecessary antibiotics or over-the-counter drugs, no, obviously. How about digestive enzymes? I would recommend this to people na merong mga, alam mo na yung pagkakain pa lang parang busog ka agad, no? Or parang hindi natunawan. Lalo na pag if you're eating a large meal, I would consider taking digestive enzyme. But digestive enzyme, based on literature, they are being established to these conditions, no, like chronic pancreatitis, pancreatic cancer, cystic fibrosis, diabetes, celiac, and lactase deficiency or intolerance. Kasi pag may sira pala yung pancreas natin, kasi ang pancreas produces digestive enzyme, no? Maraming pinoproduce siya na digestive enzyme. Pero pag nasira siya, nakukulangan tayo sa digestion. Hindi natutunaw, hindi na breakdown yung kinakain natin. Hindi natin ma-absorb ang nutrients. So sometimes we need to supplement with digestive enzyme. How about mga natural, no, like peppermint oil? Just a caution, this is not ideal for GERD, but for people who have irritable bowel syndrome, according to this large meta-analysis, it is shown to be safe and effective for pain and global symptom in adults with IBS. So, kung may IBS kayo, na-diagnose kayo, I would not start yet with mga prescription medication. I would start with this peppermint oil and see how you respond, no? Kasi mas better daw ito and safe. Consider bitter herbs or food. I'm not saying herbs lang, no, but food. Kasi may 5 different taste, no? Yung salt, sour, sweet, bitter, and umami. And then most of our diet is just sweet, sour, and salty, no? Sometimes we forget about the bitter taste, no? So that's why we have to eat mga ampalaya, mga bitter gourd, mga dandelion greens, no? Because they are source of bitter. Why they're important? Because they stimulate the digestion by bile acid secretions. But I would caution for somebody who have gallbladder stone kasi pwede kasing mag-contract yung gallbladder and can dislodge the stone and cause a problem. So really have to make sure na wala kayong gallbladder stone if you are trying to supplement with herbs like dandelion, gentian, golden seal tinctures or liquids. So, functional diagnostic test. So, meron pong kaming kasabihan, I'm a functional medicine practitioner that don't guess, do the test. Kasi we don't know what is going on in your body until we test them. So, pag may mga indigestion problem, I would recommend testing food sensitivities. No? This is a different test yung ginagawa ng regular physician, which is IgE test. This is the IgG4. Kasi may mga food na delayed yung reaction. No? Sometimes, pag kumain kayo ng food, tapos mag-manifest siya in 4 to 5 days. No? Hindi ka agad yung within minutes or hours. No? So that's why it's important na i-test natin. This is available in the Philippines sa Biobalance Institute. Expensive siya but it is worth it. Kasi alam mo kung ano yung iwasan mo. Like in this case, this is my actual patient, no? Kumakain pala siya ng milk and egg every day and look at the IgG reaction. It's very severe. So unlike sa other kinds of food na hindi masyado, no? Moderate lang, mild to moderate. Pero yung mga severe, kailangan talaga alisin yan sa diet kasi it really cause a problem. Ito naman, this is my own test. No? This is a comprehensive one. This is just a portion of the report, but this is to emphasize na tinest nila yung level ng mga beneficial at saka yung bad bacteria. And it found out na ang aking stool wala palang lactobacillus. And then I have this bad bacteria, no, Enterobacter and Klebsiella pneumoniae. Klebsiella pneumoniae, they actually live in our digestive tract. But once it gets inside in our lungs, nagkakaroon tayo ng pneumonia. And then this Enterobacter cloacae, this is the bacteria na dati pa ito eh. Even before pa, 7 years ago, nagpa-test ako kasi may nag-ubo ako before And then surprisingly, yung saliva na pinatest ko, nag-positive dito. I really thought na it's TB, no? But it's actually this kind of bacteria. So parang ito na yung bacteria na kasama-kasama ko na sa buhay ko. Kaya lang dumami sila. So I need to do something, no, para ma-eliminate. Okay, to summarize the lecture, digestive problems are very common, and most of them are due to poor diet and lifestyle. We have to understand the normal digestion para we, we know why our digestion is not working. The role of healthy microbiome is emerging and promising. No? A lot of the studies are still association, may mga link, connection, but we don't know yet if this is the cause and effect. Work with your healthcare provider if you are suffering from any digestive issues. So yun lang po, I will leave you this beautiful quote. We eat more yet we starve. We take more pills yet we still get sick. We live fast and we die slowly. Education is equivalent to optimal health. So thank you so much for listening. This is our Facebook page, Ora Medica Virtual Clinic. But I also post this lecture in our YouTube channel, which is Nourished Living. So please subscribe and share this video. Thank you so much.